Hello, my name is Annalie Martin, and today I will be discussing the different types of bedpans and how to take care of eyeglasses, dentures, and hearing aids. So, for one, with hearing aids, you're going to want to check and make sure that they, like whether they can get wet. Ask the patient how they clean them at home, because you don't want to stick that in the sink and then, ruin their hearing aid. So you do want to make sure that you clean that appropriately. Maybe if you see a spot, just clean it lightly. And you're also going to want to figure out if they have batteries, because you're going to want to make sure that they're charged for the patient. You're going to want to make sure that the volume is okay for the patient. And just because if they can't do that themselves, they may be struggling to hear you, and it may be something as simple as fixing their hearing aid. So the next thing would be with glasses. You are going to want to make sure that you keep their glasses clean. You don't want them to have trouble seeing and be uncomfortable with dirty glasses. So if you see a client's glasses are dirty, you are definitely going to want to make sure that that the client has clean, that they have clean glasses so that they can see. And then the next thing, the dentures. So with the dentures, so you again are going to want to ask the patient how they clean them at home. If they, say like they want to do it themselves, you're still going to want to just make sure that they're clean. They may use like a cleaning solution at home, which can be used, but you're also just going to want to make sure that that is like working fully. And in that case, you would just to remove them, you would take a piece of gauze to take out the top and the bottom, and you would put them in the cup and walk over to the sink. You would want to make sure that there is a towel or something to protect the sink in case you drop them, because you definitely don't want to damage the patient's dentures. And you're going to just clean them like regular teeth with the toothbrush and toothpaste, and of course with gloves. Make sure that they're make sure that you get all the food or anything that's on them. You're also going to want to make sure that the patient's gums, that you clean the patient's gums as well, because that is also very important. So when it comes to bedpans, you are going to have your standard bedpan, which you will ask the patient if they can get up themselves. If they can, if they can lift their butt up themselves, then you'll just be able to slide that under there. If they can't, then you are just going to help them lift up, turn. In that case, you would have to have them turn and get that bedpan under and have them get on top of it, or lift them up so that you can get it underneath of them. And then you're going to want to make sure that you give them some privacy, but you don't want to wait too long, because you don't want them to get a pressure wound, because then that can show that that they can get hurt, because if you leave it on too long, and you don't want them to have any marks or be uncomfortable. So it's very important to do that and make sure that you help to clean them up. Now there also is another type of bedpan it's called a fracture bedpan, and that is very thin. That would be for somebody who has a back injury, or who wouldn't be able to be comfortable with a thicker pan. So that goes the same. It's a lot thinner, so it's a lot easier to get under them. But again, you're gonna have them lift up, put that under them, so they can go to the bathroom that way. There is also a urinal type. So you would, if the patient needs help, you would have the patient put that, you would help to put their penis into it, and of course if they needed help, if they can hold it, that would be great. You can give them their privacy, and when they're ready, they can just let you know, and you can keep checking back to see if they're done, and you can take that away. And a lot of them do have a measurement scale on them, so you can take that and document that.